afternoon, everyone. I'm Sayukta from Beautiful Spotless Skin Team, and I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown color patches on their face. They seem like freckle-like spots forming large flat patches. This is nothing but melasma. Melasma is a very common chronic skin condition in India. According to a study conducted across 4 Indian cities, reveals that more than 80% of the population present skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone is more prone to pigmentary disorders. It occurs mainly in women, 90%, and 10% of males of all ethnic and racial groups. Around 20 to 30% of 40 to 65-year-old women present a facial melasma. Melasma and hyperpigmentation generally ignored as sign of aging and often misunderstood skin condition. Melasma sufferers have been misinformed about aspects of this very common hyperpigmentation issue. This can lead to frustrating setback in treatment. To avoid all these hazards and to keep you informed, today we are here to know about melasma and sunscreen from an expert. So let's connect today with our skin expert, Dr. Mahima Agarwal, live from Delhi to talk on melasma and its management. Dr. Mahima Agarwal is consultant dermatologist at Mira Derm Clinic, Delhi, and also a consultant at Fortis Hospital, Shalimar, Delhi. Dr. Mahima has completed her MBBS from Maulana Azad Medical College, Delhi, and MD from Lady Hardinge Medical College, Delhi. She also holds MRCP from the Federation of Royal College of United Kingdom and the British Academy of Dermatologists. She has many articles published in national and international journals and attended many conferences as faculty. Doctor has expertise in treatment of acne, pigmentation, skin allergies, and hair fall, and is well versed with various skin and hair rejuvenation and anti-aging treatments. A very warm welcome to you, Dr. Mahima Agarwal.
Thank you. Thank you so much for the wonderful welcome.
So, Doctor, today we are going to talk about melasma and its management. But before that, we would like to know more about melasma. What is melasma, Doctor?
So basically, melasma commonly presents as light brown or dark brown colored patches, mainly on the face, and sometimes over forearms and extrafacial sites as well. But mainly, majority of the cases are seen in women, primarily over the cheeks, forehead, upper lip area, jaw area, these areas.
Okay. So these are, called melasma. We would also like to understand, Doctor, what causes melasma? What is responsible for melasma?
Okay. So melasma, usually there's not a single etiology. You know how like in some diseases, we are very sure or we are very clear. For example, if it's a viral infection, we know, okay, this virus is causing this infection. But when it comes to melasma, it's multifactorial. There are a lot of factors going on. There are external factors. There are factors inside our body. So it's a combination of various things. So if you talk about the internal factors, the most important factor would be our hormonal status, our genetics. If suppose there's a family history of melasma in our mother, grandmother, there's a family history running, then there are chances that we may also develop melasma. Then melasma is very closely linked to a woman's hormonal status. Very commonly, we see melasma starts appearing during pregnancy when there's a huge shift of hormones going on in the body. So hormonal causes are one. Similarly, if a woman is taking oral contraceptive medicines or a hormonal treatment is going on, then that can trigger melasma. There are some medicines also which are incriminated in causing melasma, like some psychiatric drugs, like antipsychotic pills, antidepressant pills, and some antibiotics also. And if we talk about the environmental factors, the biggest factor out of them is sunlight. So it's basically a combination of all of these put together. That's how it generally starts.
Okay. Whenever we talk about melasma, we also talk about hyperpigmentation. Or rather, as a layman, I'm more, used to, or I know the word hyperpigmentation or pigmentary issues than melasma. Are they these two different words? They stand for different things, or they are the same? What's the scenario, doctor?
You're very right. Majority of the people who come to us say, Doctor, I'm having some pigmentation or I'm suffering from hyperpigmentation. Definitely, it's a more used terminology in our daily practice that we see.
Right.
So, in order for you to understand, basically, let's suppose if somebody has fever. So, fever is like a symptom which can have multiple causes. So, if somebody is suffering from fever, it could be a viral infection or a bacterial infection like typhoid or something else. Similarly, pigmentation or hyperpigmentation means darkening of the color of the skin. Hyper means more or zada. Pigmentation means change in the color. So, hyperpigmentation means when the skin color darkens. So, hyperpigmentation can have multiple causes from some causes which are not even labeled as diseases. For example, simple tanning. If you go out in the sun, you can get tanned. So that would be a cause of hyperpigmentation too. Or
Okay.
something as simple as if an insect bit you on the face or you had some allergy. When the allergy subsided or the insect bite subsided, it could leave like a brown spot. That is
Mm,
also hyperpigmentation.
mm.
So hyperpigmentation is a very broad entity under which
Okay.
there are different causes which cause hyperpigmentation. It is very important to determine which is the cause in a specific person. Again, going back to the example of fever, for example, if somebody has a viral throat infection, they might simply just need like paracetamol or plenty of fluids and it will resolve on its own. But if somebody has typhoid, then they obviously probably need a good antibiotic coverage and stuff like that. Similarly, in hyperpigmentation, if it's tanning or like I mentioned, like a bite or something which led to hyperpigmentation, which we also cause as post-inflammatory hyperpigmentation, then sometimes we don't even need to treat it because it is self-resolving. And we just reassure the patient that, look, it's going to completely fade out. Just give it some time. You don't need any treatment. But melasma is also one of the causes of hyperpigmentation. If somebody suffers from melasma, it's a proper skin disorder, it's a skin disease, which needs a proper treatment outline with lots of general measures. So, yeah, they're very different terminologies. Hyperpigmentation is like an umbrella with
Yeah,
a lot
yeah.
of.
And melasma comes under that umbrella. So hyperpigmentation is a broader word. Many
Exactly.
times, even you were talking about various factors that can be responsible for hyperpigmentation. Even after acne
Right.
subsides, then it leads, pigmentation
Lots
begins.
of spotty marks. Yeah.
Yes. Okay. Now, what are the risk factors for melasma? Doctor, you have already mentioned that, pregnant ladies are, at risk. What are the other risk factors for melasma?
Okay, so yeah, pregnancy is definitely a big risk factor. Your family history, that means your genetics, that is also an important risk factor. If a lady is taking some hormonal medicines, that could trigger melasma, some other medicines which I mentioned before, that could trigger melasma. And the most important is the excessive sun exposure. So usually the patient profile, when we look into people suffering from melasma, they
Mhm.
generally give a very chronic history of sun exposure. Like either they are, it's an occupational thing, they have to be outdoors all the time, like somebody who's driving all the time, or athletes, or some, people like those.
Mhm. Right. So they all are at risk for melasma. Now, I would like to ask you, doctor, are there any symptoms or it's just the signs, the freckles, the, patches that tells us that, it could be melasma and then we can go and approach a doctor?
Right. So, fortunately or unfortunately, there are no symptoms.
Mhm.
It's
Okay.
uh, even if you run your finger against the melasma patch, you can't feel it. It's so flat. It's It's just a change in color of the skin. That's it. There's no symptom.
Okay, so it's just the sign, the freckles
Yes,
or the patches that can tell you that it's
correct.
melasma. And as a doctor, how do you diagnose melasma? Just by, having the physical observation, or you do some scans, etc.
Okay, so I would say majority of the cases, 95% cases are simply clinical diagnosis. Like you just
Okay.
look at the person, take a little bit of history, but it's mainly what you're seeing. So
Hmm.
majority of the cases are like that. But definitely there are some atypical cases in which we get a little confused whether it's melasma or something else. Then we have a lot of tools to help us. There is a simple lamp called as Wood's lamp, which under which when we observe the pigmentation, it gives us clues. There is dermoscopy, which is like a device which gives us a magnified and a deeper view of the skin. That
Mhm.
helps us in diagnosing melasma. And of course, an invasive test is also there, a skin biopsy, which gives us a very definitive diagnosis, but that's usually never done on the face.
Mhm.
So these techniques do help us.
Right. And then, we all know that skins are in layers. So, is there a way to find out that, at till what level, the melasma had gone? It's just the superficial level, or it had gone deeper. I'm sure there are, various types of melasma as well, depending on the level of skin. Would you like
Absolutely,
to shed some more light on that, doctor?
definitely. Melasma has different types. One is epidermal, which means it's very superficial. The other one is dermal. This was like a classic thing we used to read in our dermatology textbooks. But of late, most of the scientific literature is pointing that majority of the melasmas are mixed. They almost all the melasmas have some epidermal component, some dermal component. So with dermoscopy and Wood's lamp, these kind of techniques, we get to know how deep is the pigment. If it's very superficial, it responds very nicely to treatments like topical applications or peels and lasers and all. But if it's deeper in the skin, it's harder to correct that.
Right. We always say that prevention is better than cure. Any way to prevent melasma?
Yeah, of course. So if we talk about the causes again, so genetics is one thing we cannot change, unfortunately. But if we talk about the other causes, like the medicines, if, for example, if somebody has a very strong genetic history and a lot of members in the family have had melasma, the female members, then generally we tell those women during pregnancy to be extra cautious towards sun exposure because that is the time when melasma generally starts developing. And definitely those pills like oral contraceptive pills or other hormonal treatments, we are a little cautious in giving such women these treatments, or we look for alternate therapies. So preventive measures include your mainly your sun protection and a little bit of these medicines.
Okay. And when you say sun protection, sunscreens are there. We would like to talk a bit about sunscreens as well and other physical barriers that we can, use.
Yeah.
Would you like to elaborate a little more on the significance of sunscreen as a prevention, as a preventary measure of
Of course.
melasma?
Yeah, definitely. So like you rightly said, sun protection does not alone mean sunscreens. It means protecting ourselves from sun. So sunscreen is just one tool that we have, but physical barriers, like you pointed out, are equally important. So sun
Mhm.
protection, first of all, we should very clearly know sun protection does not alone mean sunscreen application. It means specifically if somebody is suffering from melasma, then it becomes all the more important. You know how nowadays majority of the people know what sunscreens are thanks to
Mhm.
social media and so much of coverage everywhere.
Right.
But it's very important for someone who's suffering from melasma to practice the other methods as well,
Okay.
which means trying to stay indoors during the peak hours of the sun. Generally, we say like between 8 a.m. and 4 p.m. if their work allows. And by staying indoors, it doesn't mean that they're sitting right next to the window, because the window is again transmitting ultraviolet A rays, visible light, everything is being transmitted.
Right.
So, first of all, avoiding going outdoors altogether. But if they have to step outdoors, then it's very important to physically cover their face. With nowadays, masks are very handy for that. They can use a big sunglass, a broad rimmed hat, an umbrella. These are some methods we can protect ourselves from the damaging effects of sun. Whenever outdoors, try to seek shade wherever possible. And of course, then comes in sunscreens, which are one of the most important tools that we have to protect ourselves from the damaging effect of sun.
Mhm. So, along with sunscreen, we should use other physical barriers like a scarf or a wide
Very
brimmed
important.
hat,
Yes,
etc., as you said.
extremely important.
Right. But physical barriers can be used when we are going out under the sun or sun exposure is more in cases like that. But many time people or experts like you say that sunscreen is for everybody, irrespective of the fact that whether your sun exposure is much or not, even if you are working from home, even if you are working in front of a laptop, LED lights are there, etc., they are equally damaging.
Very
Even if
true.
the name suggests sunscreen, it actually protects you from various, harmful radiations.
Yeah, yeah.
What's the truth, doctor?
See, conventionally speaking, sunlight was considered the biggest culprit. But
Mhm.
as the modern science is progressing, more and more studies are being done. So we are finding out that there are other sources of light as well, like you rightly pointed out, screens, LED lights. So and I one very interesting thing I'd like to share with you is that during the pandemic, one would assume that melasma would vanish because everybody's
Ah,
indoors,
right,
but that never
right.
happened. So
Ah,
the screens, they are emitting blue light or long wavelength rays. Although not many studies have been done, but these particular rays are considered even more harmful than the sunlight because they penetrate deeper into the skin because they're low wavelength. They penetrate
mm,
deeper into the skin. They produce melanogenesis, which means they produce more pigment formation, which is more long lasting and more difficult to treat. So they are also very harmful, specifically
mhm,
for someone who's suffering from melasma. Not just these light sources, even now we have lots of literature which points that infrared energy, like if somebody is cooking for a very long time, even that can aggravate melasma.
oh,
So, you know how sunscreens were earlier marketed with filters for ultraviolet A rays, ultraviolet B rays. They were called broad spectrum sunscreens. But nowadays, we have all sorts of sunscreens, like they have filters for visible light, for infrared rays. They're
mhm,
anti pollution sunscreens, antioxidant sunscreens. And so, specifically for people suffering from melasma, it's very important to take protection from all these sources and not just the sun. So
right.
tinted sunscreens are considered a little superior for those people who have melasma because
Mhm,
they're offering, because of the tint, because of the color, the foundation like color, they're
mhm.
offering protection against the visible light as well, which we are constantly being exposed to.
Right. So tinted sunscreens are comparatively better for those who are suffering from melasma. Now, the
Yeah.
thing is that, as you said, even if you are not going out under the sun or your sun exposure is not that great, still you are equally prone to, photo damage or, other radiations or rays can actually damage your skin. And for
Yeah.
that, we need to apply sunscreen regularly, religiously. Now, the thing is, first of all, when we go out to buy a sunscreen, you have already explained that tinted is better for those suffering from melasma. But then there are so many other informations, as you stated, it could be, broad spectrum is one thing, P plus plus plus. There are so many informations on the box when you go out to buy a sunscreen for us. What are the things to look for, including the SPF? Because many times people are so, engrossed with the much of the SPF, the better it is for our
Yeah.
skin.
Yeah.
So please some
Okay.
light on
Yeah.
that as
So generally, if you buy a sunscreen, you would read stuff like SPF 30 or 50 plus, or PA factor, critical wavelength, boot star rating. These kind of things are written on the
well.
sunscreen. So, if we talk about an ideal sunscreen, it should offer you protection from all possible bad rays which are entering your skin. So, generally, the companies do mention about the SPF. SPF is a terminology which tells us how effective the sunscreen is in protecting us from the ultraviolet B rays, the UVB rays. So, UVB rays, what they do is they cause sunburns, they cause damage to the skin, they are implicated in causing skin cancers, but not too much for pigmentation.
Okay.
The main culprit when it comes to pigmentation is the ultraviolet A, UVA. So
Mm.
UVA has another index. Sometimes it's called boot star rating or critical wavelength. So when you're looking for a sunscreen for general population, I would say SPF 30 would do. But if somebody is suffering from melasma, they need even an extra, an upgraded sort of a protection. So the minimum SPF I recommend is 50 or higher, and a minimum PA rating of 4 plus or higher, or a boot star rating of 4 or higher, because it is actually UVA which will increase the pigment formation. So boot star or PA rating becomes very important for people who have melasma. And sometimes they also mention critical wavelength, which should be above 370, minimum 370. Apart from these, the texture of the sunscreen is very important. I always tell my patients that if you don't like the feel of the sunscreen, you're not going to apply it for sure. So
Right.
usually, yeah, so usually I have like a huge basket of sunscreens in my clinic. I make them feel the sunscreen so that they get a little feel of the sunscreen, if it's oily or if it's dry, because everybody's skin is very different. Some people have acne prone skin, some people have a very dry skin, some have very oily skin. So they need to be very comfortable with the consistency of the sunscreen. It should be very cosmetically elegant. So if you have a very dry face, then you might want a sunscreen which moisturizes also a little bit, like a cream based sunscreen. If you have very oily skin, then you probably would want a lotion based or a gel based sunscreen.
Mhm.
And at last, the most important thing when it comes to sunscreen is affordability, because the way we generally advise application of sunscreen is we advise a very generous amount to be applied over all the exposed areas. So it should be well within your budget if you're using something on a very daily basis.
Right. So, as you said, you need to apply generously on all the body parts that's exposed, and there is a way to apply it as well. The amount is equally important. How much are you taking? We would like you to, tell us that how much to apply, when to apply, how the reapplication is important, when to reapply. Please, doctor.
Right. So the amount is very important, because if you are reducing the amount, then automatically the SPF is getting reduced. If you're not applying the recommended amount, an SPF 50 would suddenly become an SPF 2 if it's a very thin layer. So generally, we recommend, there are lots of rules, but the simplest is that you apply 2 coats of sunscreen. First, apply 1 coat, let it just settle down a bit, then apply another coat. But if you really want to talk about ml and measurements and all, then about 3 ml or a little over half a teaspoon. One more rule is 2 finger lengths to be applied for the entire face and neck area. Reapplication is equally important, because generally sunscreens offer protection for about 2 hours or so. So every 2 hourly, you need to apply sunscreen if you're especially if you're outdoors. Then reapplication is very important. Or if you're sweating or you took a dip in the pool or something, then again, reapplication is important.
Right. And before stepping out, how much time before we need to apply the sunscreen?
Generally, we say 20 to 30 minutes. Actually, there are different types of sunscreens. If we really want to go into detail, then if we talk about physical sunscreens, they act immediately because they act by
Mm,
reflection. So as soon as you apply, they'll start reflecting the ultraviolet rays.
mm.
But if we talk about the organic sunscreens, they need some time. So 20 to 30 minutes.
Okay. Physical sunscreen. What are physical sunscreens, doctor?
Physical sunscreens are those sunscreens which, by virtue of their physicality, they are just bouncing back the sun rays.
Okay.
That's the simple way they are acting by. They are very safe. These sunscreens are the recommended sunscreens in kids because they're very safe.
Mhm.
And even during pregnancy, the disadvantage of physical sunscreens is that they leave a white cast. So they're not very cosmetically elegant. They
Right.
mainly comprise of zinc oxide, titanium dioxide, iron oxide, scalamine, these kind of things. So they make the face appear a little whitish.
Mhm.
That is why organic sunscreens are mixed in.
Right. And yeah, I can think of many cricketers or sports person with those white cast, right? But
Yeah.
then there are many people who are not yet using sunscreen as a daily skincare routine or religiously and reapplication, etc. They are not, paying much attention to that. And as you were explaining, that they have various complaints regarding sunscreen. It makes my skin look very dull. It makes my skin sweat a lot. It makes my skin patchy, or the white cast is something which I can't stand. So
Yeah.
yeah, definitely choosing the right sunscreen as per our skin type, as per our work conditions is equally important, and
Very
a
important.
dermat can help you with that. So, in case of doubt, please go consult a dermat. If you have melasma or have a family history, please consult a dermat. That's really important. Now, we would also like to talk about the treatment options available for melasma, doctor.
Okay. So once the melasma has set in, then there are lots of treatment options available with us. The simplest being the topical creams that we prescribe. We tell the patients how you're supposed to apply it, how many times you have to apply those creams. They generally comprise of skin lightening agents like hydroquinones, retinoids, all these AHAs, BHAs, arbutin, kojic acid, these kind of ingredients we generally use. Apart from the topical applications, we have other modalities as well, like chemical peels, lasers, PRP. We have some oral medicines as well, which were just recently introduced in the last, I would say, 5, 6 years back. Very effective for melasma. So,
Mhm.
if you're a viewer who's been suffering from melasma and you've tried a lot of things, do consider visiting your dermatologist because lots of new therapies are coming up.
Right.
And of course, I'm not repeating it, but sunscreen is the first thing I write in my in my prescription. Like
Mhm.
number one in capitals, I write sun protection and sunscreen. So that is
Right.
the mainstay.
Right. So no matter whether you are, you have a family history of melasma, or you're more prone to having melasma, or you have melasma, you need to use sunscreen regularly, religiously. That's really important. And definitely, if you have a family history or is, having pigmentary disorders, then it makes it even more important to use sunscreen. Please go and consult your qualified dermatologist. That's really important. Now, I'm sure you'll also agree with me, Dr. Anders, that when a person, spot these spots or freckles, etc., on their skin, they'll first go for some home remedies, some quick fixes, or consult a friend or family who has gone through the same thing. And many times we actually borrow their prescription and go to the chemist shop and get the, treatment
Very
done
true. Yeah.
ourselves. Then we definitely have our pharmacists. We'll go to any pharma shop and tell them that I'm having these pigmentary disorders or melasma, whatever. Please suggest something. It's
Yeah.
only when, most of the time, it's only when the condition worsens or goes out of our hand, out of control, that's when we go and consult a qualified dermatologist. Now,
Very
what's your stand on these home remedies or consulting your friend or family or going for over the counter medication, creams, etc.?
Right. Like you very rightly said that a lot of times people do try. It's human nature because
Mhm.
sometimes people don't they're not even aware that this is something a dermatologist would treat. They feel it's something just has happened. Maybe it's just a large freckle or something just has happened. We'll just scrub a little, it'll go off. Let's go for a
Right.
facial, it'll take care of it. Let's get some bleach done. Or
Mhm.
listen, that relative of mine also had this. She applied that cream,
Mhm.
and like you actually said, the pharmacist, the chemist shops have a huge role. They
Mhm.
are generally dispensing steroid creams, and we are dealing with a huge steroid abuse menace in India currently. They have creams which are a combination cream, like a fix for everything, be it some infection, bite, insect bite, allergy. There's a common solution to everything. So most of the patients have definitely tried some cream or like a homemade scrub or something in the past. But more often than not, it actually causes them harm. Not only does it not improve the melasma, but it also irritates the skin, makes it more sensitive. It can have very bad chemical burns, or even permanent disfiguring scars can happen. So I would strongly advise that it's a strict no, especially on the face.
Right. Skin being the largest organ of our body, skin reflects what's going on inside us. If we are healthy, we are happy, that will get reflected on the skin. So please don't experiment with your skin. Please don't do hidden trials. Go and consult the right person, which is a qualified dermatologist, in case you have anything which is not normal on your skin. Then, with over the counter medication, I'll again like to come on that, doctor, because what happens if, for example, I am experiencing some spots, freckles, etc., I'll go and contact you. B, I'll go to the chemist shop, take those medicines, use them for, because initially those steroids works like magic on our skin. So, their immediate effects are really good. And it's so good that we get addicted to those. And it's only when they stop working, then we realize that, oh, our skin is getting, darker and nothing is working. That's when we go and consult the doctor. Now, a person who had already gone through what you were saying, steroid abuse, and then consulting a doctor, what is the difference in the treatment length, or, because initially, if I go immediately after spotting a single spot or something, maybe the treatment would be easier, and rather than when I go after a steroid abuse. So, what's the difference, doctor?
Yeah, very true. If uh, we get a person who's not applied anything, it's a very fresh case of melasma, we right away start with the treatment. And we are obviously, if we start with the treatment early on, then we are bound to get better results. But if somebody has applied steroid creams, have experimented, then first we have to correct that part. We have to get them off the steroids, get them back to their normal state, how it was, cut down the steroid dependence. Because on that phase, where which is so sensitive after steroid abuse, we just cannot give the uh, medicines which we usually give to treat melasma, because they would further irritate the skin. So the initial few months we are treating that. Once the skin settles down, if at all it does, because it's very hard to treat, then we start with the treatment of melasma. So for the first few months, we are left with no option but to just advise sunscreens and maybe some very weak, milder agents for melasma, which may or may not show effects.
Right. So it's very important to, save us from all the lengthy treatments, etc., and go to the expert immediately. Now, I'll quickly take some of the questions that have been asked by our viewers. Kirti Kapoor is here asking, is there any way to effectively manage my melasma without completely avoiding the sun? I love spending time outdoors, and it's tough to feel like I have to constantly stay covered up.
I know it's so tough because we don't want this to happen either, that your quality of life starts getting affected, and we don't want to restrain you indoors. But um, without effective sun protection, treating melasma is next to impossible. Because as if she's suffering from melasma, then probably she might have had recurrences too. The thing we say happens in melasma, unfortunately, is that even if we achieve a very clear face with treatments and everything, we are very religiously applying the creams, we've gotten what we wanted, it can come back anytime. Even like a few days of intense sun exposure would again trigger it. I have had so many patients in the past we've managed to control the melasma, looking absolutely normal again, but they went on a holiday. There was a lot of sun exposure, and there was it again recurred. So sun protection is something which is the mainstay thing in therapy. But of course, if you love going out in the sun, then choose the hours. Don't go when the sun is too bright, maybe in the wee hours of the evening or slightly when the sunset is happening. With adequate sun protection, you sit in the shade, then you can still do that. But without sun protection, it's nearly impossible.
Right. Another question by Shania saying, why do women get melasma when they are pregnant? Though we have already spoken about it a lot, doctor, I would like to add to this question that, because when a lady is pregnant, we normally avoid various medicines. In fact, whatever she is taking is just under the guidance of her doctor. Now, because again, they are more prone or at risk when they are pregnant, the thing is that they can again go for over the counter medication. How dangerous can it be for even in choosing sunscreen? Because many times it's written on it that, a lactating mother or a pregnant
Not
woman
for
should
them.
not use it. That goes same with topical creams, etc. So, how important it is for a woman who is pregnant and is having melasma to avoid over-the-counter medications or anything on their skin to prevent them from melasma. Just by
Okay,
randomly.
that's a great question because somehow our mindset is such that creams can't harm us, and creams is something like a
Because it's a topical thing,
moisturizer.
I mean,
Yeah,
we are
it's
not
not
eating it, we are not putting it inside our body, right?
right. So uh, very frequently we do get patients who come up to us for a chemical peel during pregnancy because they feel that peel is something very external. It's not going inside. So, but it's very, very important during pregnancy to avoid topical applications as well of certain products. There are a few medicines which are considered safe during pregnancy. So, if you've been suffering from melasma or acne or anything for that matter, and you've conceived, the safest would be to stop everything or visit your dermatologist or visit your gynecologist to find out which medicines are still safe for you, and then only continue those. Again, when it comes to sunscreens, like we previously spoke about it, physical sunscreens are something which are very safe during pregnancy. So, a switch in sunscreens is also recommended during pregnancy.
Right. And I'm sure all your patients with melasma must have, asked you this, that will it permanently go away, melasma? Will it be permanently,
Yeah,
cured some point of time?
I know.
What's your take on that, doctor?
It's very disheartening, but that's the first thing we generally tell people who have melasma is that look, we can really control it. It's definitely going to get better. It's going to lighten up for sure. It
Mhm.
may even disappear with very good, if you're very compliant, you're protecting your face from sun exposure and all of that. But we have no how should I put it, we have no control on whether it will recur or not. It can recur uh, in anyone. It's there is no medicine, or there is no single thing, or there is no single medicine that if you take that medicine it's gone away forever. It's till now it's not happened yet.
Right. And one last question from a viewer, Neha Sharma is asking, can stress and lack of sleep make my melasma worse?
Um, Not directly, but if you're not sleeping, then if you're um, scrolling on social media or constantly exposed to screens, that could be an indirect cause. And how we doctors generally say is that stress can aggravate anything. So from that point of view, we can, I mean, there are no clinical studies on stress and melasma or lack of sleep and melasma. But what the stress and lack of sleep brings along with it, that can aggravate your melasma, like screens and all.
Right. And doctor, before we sum up, any take-home message for our viewers?
Yes, definitely. Lots of take home messages. If you feel there's an unusually large freckle somewhere on the cheek, it could be melasma, which is not a very simple thing. It's a proper skin disease, which is treated by dermatologists. Second take home message would be that do not experiment with your skin. Avoid using homemade pastes or scrubs or lemon juice or these kind of homemade packs. Don't use over the counter creams unless you're using a vitamin C serum or something like that. That is still fine, but no medicated creams should be used, especially on the face, without consulting a dermatologist. And prevention is the key, which is very good sun protection, especially if you have a very strong family history.
Right. Thank you so very much, Dr. Mahima Agarwal. It was wonderful talking to you. Thank you for your valuable time. It was a very informative session. I'm sure our viewers are going to, benefit by it. Thank you so very
Thank you
much
so
once
much.
again.
Thank you.
And viewers, thank you for your active participation in today's session. Stay connected to our beautiful Spotless Skin page. Stay happy, stay healthy, and keep glowing. Thank you. Goodbye.
Bye.